Hi everyone, welcome to my podcast. I'm your host Chloe, a master's level social work student, here to dial in on one specific theory used in the social work field. Today, we're going to be talking about the crisis intervention theory. This is a very important approach in social work that focuses on how we support people during moments of intense stress or trauma. A crisis can happen suddenly and leave someone feeling overwhelmed and unable to cope. Whether it's because of a loss, violence, a disaster, or a major life change, this theory helps social workers step in during those moments to provide immediate support, stabilize the situation, and help people regain a sense of safety and control. In this episode, I'll be breaking down the theory in a clear and practical way. We'll talk about where crisis intervention theory came from, the history behind it, and the research that supports how and why we use it. I'll also explain how it fits into the field of social work and why it's such a valuable tool for helping professionals. And finally, we'll look at how this theory shows up in real life, where we see it in action and how it is used as an intervention to support individuals, families, and communities during some of their most difficult moments. So, what defines a crisis? According to Washington State Department of Social and Health Services, a crisis is a disruption or a breakdown in a person's or family's normal and usual pattern of functioning. A crisis cannot be resolved by a person's customary problem-solving resource and skills. In regards to mental health, a crisis is a loss of psychological equilibrium. There are so many environmental situations that can happen where a family or individual may end up in crisis, like family situations, economic stress, community situations, significant life events or changes, and also natural elements. That we have an idea of what crisis looks like in the social work field, we're going to look at the crisis intervention theory. The crisis intervention theory was in the works around World War II, but it wasn't until Eric Lindemann and Gerald Cahalan came around to developing the process of this theory. In the book Emergencies in Mental Health Practice, Chapter 2 by J. Cahalan, there is an extensive amount of history in how the theory came about. In 1944, Lindemann had provided the concept of crisis as being a turning point in which included danger or opportunity. His classic work also mentions the outlines of normative developmental crisis throughout life and has had a major impact on the field of crisis intervention. Gerald Cahalan came along in 1961 and continued on his work. His work on preventative psychiatry and community mental health is the foundation of the crisis intervention theory. Overall, the crisis intervention theory provides a framework for immediate and short-term psychological care designed to stabilize individuals in acute stress and return them to their pre-crisis level of functioning. Some key facts we want to know from the crisis intervention theory is that immediate action is vital. The goal is always equilibrium, and it is not a cure. We also want to look at the structured approach, looking at models like Robert's 7-stage model, and also other coping strategies. While I was conducting my research, I found an article that was about the 9/11 attack and how New York City employees were affected. The researchers did a baseline telephone survey a year after the attack and were able to get 1,681 respondents to follow up on 2 surveys. The study found that workplace crisis interventions provided by many New York City employers after the attack had lasting positive impacts on employees' mental health. In this study, workers who had received brief counseling sessions showed lower risks of problems such as binge drinking, alcohol dependence, PTSD symptoms, depression, anxiety, and overall impairment compared to those who did not receive help. As little as 2 to 3 sessions appeared to produce the greatest benefit, with improvements lasting up to 2 years later. Despite the study's limitations, the researchers concluded that such interventions should be considered as a primary strategy for supporting mental health in future community crises. This was based on the findings of the work-based crisis counseling and how effective it was in this instance. One of the main concepts of this theory is to act fast, and the faster you are to the time of crisis, the better. This piece of research helps prove that that concept is accurate. Another study found was based on COVID-19 and patients who had experienced high levels of stress, depression, anxiety, and a low quality of life during this time. The goal of this study was to investigate the effectiveness of crisis intervention based around stress, anxiety, depression, and the quality of life of a patient within COVID-19. The study used a randomized controlled clinical trial of 30 patients that were randomly selected and divided into a control group and an experimental group. The stats of these 30 individuals who did receive the intervention were significantly higher. Overall, the study did conclude that the intervention could reduce negative effects of patients with COVID-19. Therefore, the intervention can be used as a beneficial treatment to improve mental disorder symptoms and to improve the condition of people who are suffering from COVID-19. When looking at the descriptive part of this theory, we want to think about what is happening. What happens during a crisis? How are people's reactions, behaviors, and emotional process? The descriptive theory helps us describe shock, fear, confusion, anxiety, and the nature of a crisis. It is very important as a professional, and especially in the social work field, to use the descriptive part of the theory to be able to recognize what people are experiencing. Going back to Gerald Kaplan, who was the pioneer of the crisis theory, he describes how individuals move through the phases of crisis when usual coping skills fail. Kaplan was the first clinician to describe and document the 4 stages of a crisis reaction and applying it to the crisis theory. The first stage is initial rise of tension from the emotionally hazardous crisis precipitating event. Next, we have increased disruption of daily living because the individual is stuck or cannot resolve the crisis quickly. The third stage is when tension rapidly increases as the individual fails to resolve the crisis through emergency problem-solving methods. And lastly, the person goes into a depression or mental collapse or may partially resolve the crisis by using new coping methods. Once we know what's happening during the crisis, we move over to the prescriptive part of the theory, which explains what helpers should do about the crisis. This is based around the response, which we have many models through the theory and intervention itself. One of the most commonly used crisis intervention models within the social work field is Roberts' 7-stage crisis intervention model. Roberts says that these stages listed below are essential, sequential, and sometimes overlapping in the process of crisis intervention. Step 1 is to plan and conduct a crisis assessment. Then we move to establishing rapport and rapidly establishing a relationship. Step 3 is about identifying major problems, looking into the crisis, and seeing what is going on. Stage 4 is dealing with the feelings and emotions around the crisis. Stage 5 is to generate and explore alternatives. Stage 6 develops and formulates an action plan. Then we get to stage 7 at the top of the model and pyramid, which is to establish and follow up plan and agreement. I would argue that this theory overall matches the social work's mission and core values. Crisis intervention, which stems from crisis intervention theory, is being used all the time by social workers and professionals, like in hospitals, schools, child protective services, disaster response, and mental health agencies. This theory is also closely tied in with the ethics of social workers. They're there to help clients and recognize their strengths. They're there to mobilize support systems and also restore a sense of control. The crisis intervention theory overall is really important within the social work field because it teaches professionals on how to help people in the worst moments quickly, safely, and effectively. As a social worker, I do think that I will be actively using this theory and the intervention that stems from the theory. One thing I would like to note, and that I did learn while doing my research on this theory, is that there is a lack of research. A lot of the interventions that are being used for crisis now are based on existing models, but they're often heavily focused on individual biology or psychology, and they neglect the social, relational, and environmental context. The research is not diverse and does not include a lot of different populations. As social workers, we need to be aware that not every single set standard model is going to work for the same for every person. Thank you so much for listening, and I'll see you next time.